Yeah, bring the shorty up here. We have a green tube. Green is always oxygen. Okay? You'll see a little light blue here underneath the green inject. That's nitrous oxide. This nice sky blue is going to be nitrous oxide. Room air is going to be yellow. Why they want room air on here, I don't know. Doesn't matter. It's on there. We don't use it. Black is going to be nitrogen. Black is used to run power equipment. Okay? Because nitrogen does not support life. They used to, years and years ago, when they first came out with power equipment, they used to use compressed air. And of course, there'd be all kinds of bacteria in it. You're in there running a compressed air drill, and it's blowing all these bacteria all over the field. So they went to nitrogen. This is an emergency tank in case something happens to the main large reservoir. That's all it is. These are both exactly the same. They make the little dials go up. And on this one, when we come around to the front, the oxygen comes in the side of this, okay? Comes to, and here we are, all color-coded, green. Here's your dials for green, and you can read up there. Now, what this tells you is the pressure in the lines over there and how much is there. Okay? So you don't need to worry about that other than the fact that it tells you. This has 2 flow meters. These 2 right here. Simple machines only have 1. Simple machines read in terms of 1 liter, 2 liter, 3 liters. This one, if you're less than a liter, it'll read on the left-hand dial until you get over a liter. Then this one maxes out, and this one starts to go up. So it's just as if they were stacked on top of each other. That's all it is. The rest of them we don't worry about because we don't use them. But again, it tells you the flow of room air and nitrous oxide. And this machine has a bunch of bells and whistles when things don't work, so we don't worry about them anyway, because they don't work. So, don't let seeing two, this really confuses Janet, having these 2 dials up here. Just, she's used to my machines, which only had 1. And this really, don't let it confuse you. It's simply below a liter. It allows you to finely adjust the flow of oxygen. That's all it's doing. So, otherwise, you could only adjust, as you'll see in the other machine, in half-liter increments. This one lets you get in these lower flows. For example, you were doing a puppy, which weighed 1.5 pounds, and you wanted to only flow 200 or 100 ml of oxygen, which would be a lot for that puppy. You can do it. On the simple machines, you can't. You got to flow a liter. So it's blown out in the room and wasted. So, comes in, goes through, magic things, goes through the vapor. I mean, there's a bunch of pipes back there, is all it is. You don't let it worry. Comes out here and goes through the vaporizer. This is the amount of oxygen you've dialed here. Goes into the vaporizer. Again, goes through the magic of the machine. And comes out right here. Okay? It just goes through a bunch of lines under there. Comes out right here. And goes over to this right here. And because, I guess this one does it. Okay. So anyway, the oxygen comes over and now is entering the patient circuit. Everything else has just been in flow. So this vaporizer is not in the patient circuit. We used to have vaporizers, some of them in the patient circuit and out of the circuit. This is an out-of-the-circuit vaporizer. That's what puts our anesthetic in the oxygen.
What is standard now?
Out of the circuit. We still teach in the circuit, but I was thinking last night when I was getting ready for this, I can't think of any anesthetics that are currently being used or even planned that are in the circuit. Metafane was the one, but that's been discontinued. In fact, you can't even buy it. And what we're talking about, the patient circuit, yeah, there's my old circle. So this is going to the patient, right? So we know these two are in the circuit, and as I've told you before, nurses and physicians aren't the brightest in the world, so they got them labeled expiration, inspiration. Otherwise, the physicians would never figure out which is in and out. So you have the advantage on this machine. You have two little valves. See that little? It's just like a little wafer. Okay? That's called a micro valve, or a flutter valve, or a one-way valve. All three statements are used in our textbooks. One-way valve is a lot of condensation in there, okay? What they do is just like the name implies. One-way valve, they only allow the flow in the circuit to go one direction. And this is expiration. So when the patient breathes out, it can go through this one. When the patient breathes in, it can go through this one. And if you're confused, you go, and see, I blew in, and did you all see that? It raises up. However, when I suck in, that one opens, and this one stays closed. Boy, is there halogen in there. Oxygen. But anyway, we've now traced this circuit here. What are the other things that are in the patient's circuit? Well, a reservoir bag for the excess. Remember, I'm a simple person, so I try to keep things simple. Reservoir bag. That's for the excess oxygen. When I breathe in or out, it's got a place to go. It doesn't get hung up in the circuit because there's an expansion area. For those of your plumbers, it's just like an expansion tank on a hot water line. Okay? So we've got for the excess oxygen to go there. Well, if a patient's going to suck that air back in that he's already expired, what's it full of? CO2, right? CO2 absorber. So before he sucks that air back in, or those gases back in, it goes, his expired air goes down through the CO2 absorber, is joined by fresh oxygen and anesthetic, and can now go up to his inspired side. Now, along with our reservoir bag, if we keep adding fresh oxygen, this reservoir bag is going to keep getting bigger and bigger and bigger, right? Because we're not, remember first law of thermodynamics, things can't be destroyed, they can only be changed in form. So we're taking oxygen in and we breathe CO2 off, right? So the volume is going to be the same. But we keep adding fresh oxygen and anesthetic to keep our oxygen up because we're using it up. So now it comes in here, the bag fills up, it's got to go somewhere. So we have a relief valve or a pop-off valve. Pop-off valve is in the patient circuit. So the things that are in the patient circuit, pop-off valve, flutter valves, CO2 absorber, a reservoir bag, and it's always nice to know what the pressures are in the circuit because lung tissue ruptures somewhere around 40 to 50 centimeters of water. So it would be nice that when we're giving a patient a breath that we don't exceed that. So we have a manometer on there to tell us what the pressure is in the circuit. So if we close, for example, patient's not taking deep enough breaths, and you've heard me mention bagging the patient, or ventilating the patient, or sighing the patient. You know, we all sigh normally. What we do to sigh the patient while they're under anesthesia is we close the pop-off. Of course, this is sealed because it's going to the patient. The bag is going to fill up. Okay, now, We have oxygen in the bag and anesthetic. We have a manometer that's at 0. So now we squeeze that bag and we take them up to the desired pressure. We've now ventilated or sighed the patient with the anesthetic machine, or bagged them, which is, I don't prefer that term, but it's so common I can't do anything about it. Okay? And that's what we've done. See, it's relatively simple. It's not a real, it looks complex. It's got a bunch of other things on there which we don't use. This is, back here, a mechanical ventilator. It breathes for the patient, whether they want to or not. And you set it so many breaths per minute at a certain volume. And then this machine goes up and down. This one goes up. And the patient has to take in that amount of oxygen and gas, other gases that we've added, the anesthetic agent. So that's all that is. And it's got a bunch of dials. You set its tidal volume. We'll go all through how to set tidal volumes, all that kind of stuff. But that's an ancillary thing. That's an extra device. It's not on most veterinary units. Although most veterinarians are today have ventilators of one kind or another. And they're all different. But we'll talk about ventilators, but we're having some problems with this, and so I don't like to put a real patient on it. Any questions? Okay, I'm going to take this one on in here, and we're